To be very honest, I have prepared for the NEET for only 2 months since I was targeting INI, and that's why I have genuinely only focused on this app. I don't know what additional things are given in this book or that book or that source. Only and only religiously followed speed. Yes, for INI it was Shackelford and Bloomgart, no doubt in that. And of course, you, sir, the whole speed faculty. Without you, I cannot clear. I am sitting because of you. I am sitting in ILBS working as a state resident. That's all because of you. No, I'm seriously, sir, because I have not read anything apart from this during preparation phase.
So I bring in all the wishes and greetings on behalf of all the faculty members of Speed Medical Institute to Dr. Kedar Patak for scoring a amazing rank and the topmost rank of CML 2, AML 10 in MCH Surgical Gastroenterology in INISS session November 2023.
Thank you very much, sir.
You know a detailed background history from where you started your career.
Sir, hi, my name is Kedar Patak, as you mentioned. I have done my MBBS 2012 batch from Gujarat only, GMERS Medical College, Patan. So yes, I have completed my MS from Medical College, Baroda from 2022 batch. Then I completed 1 year of SRship and bond from Baroda Medical College only. And then I appeared for both NEET and INISS. I got rank 120 in NEET. And I joined ILBS, Institute of Liver and Biliary Sciences, in MCH HPB surgery. And simultaneously, I also got the rank of 2 in INI. So it was actually very surprising. Although, to be honest, I was targeting and I was working for INI. Actually, NEET was a, what you call, incidental thing. But yeah, that's what it is.
Very good, doctor. Excellent. Now, can you share how you prepared for NEET and how you prepared for INISS?
My preparation strategies were actually quite different. So first, talking about NEET, for NEET, I have used only speed. I mean, during the preparation time, I have not opened a single book, and actually not even Bailey and Lowe. Yes, I have read during my MS thoroughly, but during preparation, only and only speed, and I have made my own notes from the videos only, but I have made my own notes. So that's the one thing. For INISS GI surgery, I have read Shackelford and Bloomgart completely. For that, I have not used any other resource other than Shackelford and Bloomgart. But yeah, for NEET, and actually, sir, to be very honest, I have prepared for the NEET for only 2 months since I was targeting INI. And that's why I have genuinely only focused on this app. I don't know what additional things are given in this book or that book or that source. Only and only religiously followed speed. Yes, for INI, it was Shackelford and Bloomgart, no doubt in that.
Great, doctor. Can you tell us, was that a full-time preparation or?
No, sir. I was working as a SR, bonded SR. So it was not a full-time. But yes, sir, I was consistent. Even if it's 1 hour a day, I used to read. I was consistent rather than, read twice in a week, but 8 hours, not like that. Daily 1 to 3 hours, depending on the situation.
Very good. Very nice. Now, why surgical gastro as your choice?
So there are 2 reasons for that. One is, of course, like any other surgery resident, the first thing that you get exposed to is this GI surgery. And particularly in our institute, we have lots and lots of cases of pancreatitis. Even my dissertation and my research, my thesis is also on pancreas. So pancreas was the one and that's the reason I am sitting in ILBS. I have packed HPV surgery. So yes, and the other reason is, sir, I always wanted to be an academician, or I want to be an academician. I want to join a government institute. I want to start my own department. So in our part of country, Gujarat, Western India, there are very few institutes. So I should say no institutes have GI surgery department so far. So it was a motivation for me that I know it sounds really idealistic and all, but yes, while preparing, that was my mindset.
Great, wonderful. Now, what is the message that you want to give to your future aspirants of MCH Super Speciality and also for SGE?
As far as NEET is concerned, I sincerely say that make your own notes, use speed, or for that matter, whatever you are using, but make notes and follow it thoroughly. You cannot revise, since the course of NEET is so wide, you cannot revise if you use textbooks. Of course, the MCQ preparation part is, although I have never prepared MCQs, I have never done MCQs. I know it's not a good thing, not an advisable thing. But for INISS, I would say Shackelford and Bloomgart they are very heavy books to retain. You can read it once, you cannot remember it, and certainly it's very difficult to revise. So what I used to do, that whenever I see any patient in ward, let's say of pancreatic necrosis, so I used to go and read that. So by the time, during the preparation year, time of 1 year, you will revise that one thing multiple times. So that is for INI, GI surgery. For NEET, I think you should follow speed and make your own notes, revise it multiple times, solve MCQ, that's all. Very compared to NEET UG and NEET PG, NEET SS, I feel is very simple exam. It's very, we are already MS or MD. We have cracked 2 competitive exams, major competitive exams. I think MCQ solving and all that skills are already in us. So the only thing that you need to do is be thorough and be in depth as far as INI is concerned. And for MCH NEET, it should be broad understanding. So that's also.
Great. Time to thank whom all you want to thank. They have supported you till date.
Sir, of course, first and foremost, my parents, my wife. I always believe that a good life partner can make wonderful changes in you. And yes, even teachers, but the one person who I'm particularly thanked to is my wife. Because of her, I am there. She has constantly supported me in each. There were major downs, but she has supported me. She has belief in me that yes, you can do it. So, and of course, sir, you, sir, the whole speed faculty, without you, I cannot clear. I am sitting because of you. I am sitting in ILBS working as a first year resident. That's all because of you. No, I'm seriously, sir, because I have not did anything apart from this during preparation phase. For INI, I would say my wife.
Very good, doctor. Congratulations. Once again,
You,
we bring in all the wishes to you for a great career in MCH surgical gastroenterology as your specialization. And you will do great, and you'll always keep inspiring us every and future. All the best to you.
Thank you, sir. Thank you, sir. Thank you, sir. Thank you, sir. Thank you.